Let's review some sacrum anatomy. When we are looking at a posterior view of the sacrum, we need to be able to identify a couple of osseous features. First, we can see this portion of the sacrum. This collectively is referred to as the median sacral crest. Each of these tubercles are the remnants of the spinous processes of the 5 separate segments that fuse together to form the sacrum. Then we can see these holes. From a posterior view, we call these holes the posterior sacral foramina. Then we can see these processes. These are called the superior articular processes because they are going to be joining up with the inferior articular processes of the L5 vertebrae, articular referring to the fact they form an articulation or a joint. Then we can see how the sacrum kind of wings laterally. These are the sacral ala, the portion that forms the wings. Ala means wings. We have these surfaces here. These are called the auricular surfaces. These are going to join up with portions of the ilium to form the sacroiliac joints. Then we can see this empty space here. This is called the sacral hiatus. From a lateral view, we can see this forward projecting portion of the sacrum, which is called the sacral promontory. From an anterior view, we can see these holes again, but from an anterior view, we call them the anterior sacral foramina. And then we can see these ridges that are running horizontally. Those are called the transverse ridges. So some of the osseous features of this bone, the sacrum.